We have big news from the FDA. They have submitted for approval a new rule. Basically, it is front of the label nutrition labels. We're all used to seeing nutrition labels on the back of food, but now it'll be clearer and easier to read on the front of labels. But they're only including 3 ingredients. So the new front of the label packaging will just have information regarding saturated fat, sodium, and added sugars. So this is interesting because there's been lots of talk about these front of the label packages, and this is kind of the latest reiteration of it. Like they've had previous proposals, this is just the most recent. And basically those 3 levels or those 3 ingredients would have on the front of the package, it would state like a medium, a low, or a high level, like a low, medium, and high, based on the percentage of daily value. So if an item has 5% or less, it would be considered low. If it was between 6 and 19%, it would be medium. And if it has more than your 20% daily value, it would be listed as high. Now, in theory, these would be based on serving sizes. And if you remember correctly, serving sizes are not regulated. They are based on what the average consumer would consume. Perfect example of this is in the past, when you looked at a bottle of soda, it would say 2.5 servings. The FDA came back and said, no, that's not what an average consumer would expect. They would expect 1 bottle of soda to be considered 1 serving.
Yep.
So on the front of the package, it would now have, information regarding those 3, and that's pretty much it. Now, some of their different options originally had the number of calories per serving, but that was since removed. Now, there's a lot of different like advocacy groups that are very much for these changes, but it gets a little gray. Okay. Yeah. So the first thing is the proposed rule would not apply to any foods marketed toward children under 4 years old.
Weird.
Okay? That's a little odd. The only products I know of that are specifically targeted for 4 years old and under are things like teething biscuits, early foods, baby foods. So that's a little weird.
Paw Patrol yogurts.
That could be over 4.
Oh, yeah. Yeah.
But I'm thinking of like the Elmo shelf-stable yogurt that weirds me out.
Yeah.
Okay.
Yeah. Okay.
So that part's gray. That's a little weird. Then the FDA is also going to amend the nutrient content claim definition for low sodium. Okay. Because you see on a lot of packaging, it'll say lower sodium. So all they had to do is lower it by 1%. But now with this proposed rule, an item can only say low sodium if it's under 115 milligrams or less. Previously, it was 140 milligrams. Now, the average consumer eats about 6 times the amount of recommended sodium. I believe it's 2,800. So, that's a lot.
Yeah.
Now, the next part is that if this rule is finalized, food manufacturers will have 3 years to update their packaging. Now, it's funny because if you sell more than $10 million worth of sales, you have 3 years. If you sell under 10 million, you have 4 years. How long does it take to change your package?
10 million's a lot regardless. The little guy gets an extra. Is that even little?
Yeah. Now, what's interesting is they gave some estimates of what it's going to cost to relabel. But honestly, packages change all the time. It's not that big of a deal.
Right.
But this is interesting. It says, although reformulation is not required under the proposed rule. So they're not telling companies they have to change their formulas in order to fit new standards. But I guarantee you that companies don't want to do this, because if all of a sudden on these three, saturated fat, sodium, and added sugars, if they hit high on this new nutrition label on all three of them, their sales are going to tank. So it's
Probably.
going to cause companies to reformulate in order to not have three highs, because that would be like three X's on the top, on the front of the label.
Yeah.
And if you had any concern about your health, you're going to go, ooh, I'm not picking that one.
Right.
So here's where, like, we start the bickering process. Okay. Yep. So the American Heart Association, the Center for Science and Public Health, and Health Eating Research all support the new changes, calling it an empowering tool for consumers, as well as an incentive for food companies to make healthier products, all the while helping to reduce diet-related chronic diseases. So right. Even the advocacy groups, they are acknowledging that this is going to cause companies to change their formulations.
Yeah.
So now we get into big food. That's Consumer Brands Association, the Sugar Association, the Food Industry Association, the lobby groups, big
Yay.
food. They believe the suggested changes will be too expensive to make and will not improve consumer understanding of overall dietary patterns. Plus, they're saying it is based on outdated or opaque research. Okay. These lobby groups are not exactly known for transparency.
Right.
So the fact that they are now blaming research as being not transparent enough comes across a little calling kettle black.
Right. They're the ones who pay for the research. So if your research it has all this opacity, you put it there. That part.
Yeah, no. So the FDA says by focusing on three main areas, it will help consumers identify the healthiest products, allow easier comparing of labels, and encourage healthy choices. Right now, if you take three products, you have to turn them around in the store. You have to kind of convert to see, servings and to be able to line them up. It could be a process. But if you didn't have to touch a product, you could just look on the outside packaging and be able to compare them on the shelves, I think the average American would be more likely to look at something.
Yeah, I definitely think it's going to influence behaviors. They've been forced to include this information for so long and have gotten away with putting it on the back, making it more difficult, and instead focusing all on the shiny bits and your fonts and the colors and the new improved formula.
Well, and when you look at a nutrition label, it's got like 20 different things.
Yeah.
It's telling you your label of riboflavin. I don't even know what riboflavin is. Do I want that? I'm not sure.
No.
But I'm just saying, I feel like they're right that the big nutrition label, it's overwhelming. Mm-hmm. And so by focusing on three things, maybe it'll give people just a real quick glance. Now, both the industry stakeholders and the public health advocates agree that the calories should be on the front label. And honestly, a bunch of products already have calories on the front of the label, but it's not necessarily an FDA requirement.
Right.
Now, previous FDA proposals did include calories. This one just didn't happen to do it, so it could be changed again. Now, here's where we get really kind of weird, okay? So, the Food Industry Association's chief public policy officer, call this the mouthpiece of the lobby industry, said the overly simplistic design will not help educate consumers on how to improve their overall dietary pattern. So they're saying it's too simple for something so complicated that the average Joe isn't going to be able to follow it. Does that
So
just sound snarky?
it yes, 100%. And it also makes it sound like, hey, we like that it's overcomplicated because it's now too much information for you to be able to process in a way that's helpful. So let us keep confusing you and you'll keep buying it. The one
And
thing I
your chronic long-term diet related illnesses will stay on top.
that part.
And don't you think it's funny that these same lobby groups also stated, wasn't it the Illinois legislature was not smart enough to
Oh
make
yeah.
changes to people's food, to
Yeah.
understand the changes made to people's food.
Yeah.
So I
Yeah,
just
yeah,
feel
yeah.
like their immediate response to anything is, y'all are too stupid. You just don't know what you're talking about.
Pretty much. I think the only thing I didn't notice that I think would be truly helpful is whether they're going to have the serving size or not. Because a lot of people, I think, neglect that as data, real data. Because, like, it could be low sugar, it could be low cholesterol, it could be low sodium, but it's 2 cookies. So, like, if you've got a serving that's 6 of an item or a box their serving size is 2, but they both have the same amount of data, like that's
And
real
it's
information.
supposed to be per serving, but it's not really clear if it'll explain how big a serving is. So
Yeah.
that way you would be able to see this is 2 cookies versus this company is 4 cookies. It's not very clear.
It
Now,
bugs me when people do their serving sizes and it's like
two and a
this
half
one's
cookies.
1 ounce. I'm like, it's a package
Like
that's
who's
two
carrying
point
a scale? Who's carrying a beef jerky scale to
right.
make sure
It's
that they're eating the right amount of servings
exactly that. Like, oh no, I can't eat more than 1 ounce. I will then exceed my salt limits for the day.
for 2 days?
That's
Okay, so here's the dark side. Like we hit the weird side, we hit the gray side, now we hit the dark side.
oh.
The Rudd Center for Food Policy and Health says that the FDA focusing on added sugars will have unintended consequences. They propose that companies using non-nutritive sweeteners just so they can claim low or medium in added sugars. That means more artificial sweeteners can be hidden behind chemical names that the average American do not recognize and will be included in food, especially those that are aimed at minors. Maybe not under 4, but definitely under the age of 18. Think of your
Yeah.
cereals, your junk foods, even your sodas.
Yeah.
So,
So the slightly off tangent, but not necessarily. When they made the changes to school lunches and limiting the amount of salt, sugar, and things like that are allowable in the kids' lunches, a lot of kitchens actually make their money from the extras they sell, the drinks that are stocked through Coca Cola, or at least here it's Coke. Some places might be Pepsi. But because of the limitations on sugar, all of the drinks they offer are the zeros, are all the artificially sweetened. The Propels,
because it
Cokes.
was the only way to get under the limits.
Yep.
Like you couldn't get full regular sugar, you had to have diet.
Yep.
That's
Every
crazy.
single one of them is all artificially sweetened.
Well,
And
and do you know why 100-calorie packs are 100 calories?
no.
Because that it's a mental thing. If I'm
Yeah,
just
that
having
makes
a
sense.
snack, 100 calories is not that much. So
Right.
when they package all these snacks, well, sometimes that means 100 calories is only 17 and a half crackers.
Yeah.
Who's going in and breaking every 18th cracker to make sure, you know,
Yep.
and, it's 14 raisins. I mean, have you seen some of these packages? I mean, they look like they're big, and then you feel it and
Mhm.
you're like, did they
There's
forget to
nothing in
fill
here.
this one?
It's like fruit packs, like the little gummies. It's
Yeah,
like there's like
there's
six
7.
There's 6 gummy bears in here. Great.
Yeah.
Fantastic.
But this goes to show that serving sizes, even though it's supposed to be what the average person would sit and eat, it
Hmm.
can also be manipulated
Yeah.
because, yes, if you were expecting a 100-calorie snack, then yes, you would only be expecting these 14 and a half raisins. So that's an expectation. Whereas anyone else on the planet who's going to have a serving of raisins probably is going to eat 36.
Yeah.
But as soon as you become a 100-calorie consumer, now it cuts down. Serving sizes are not regulated. And so I have a feeling that there's been all this talk on social media, especially for like Kraft mac and cheese, nor pasta sides, where they've adjusted to where basically the amounts of their serving sizes. Well, serving sizes are kind of irrelevant because it's not the recommended amount you should eat.
Right.
It's just supposed to be how much the average person would eat. Well, I expect a whole bunch of serving sizes to change because companies are going to want to make sure that at worst case scenario, they hit medium in all three boxes. Because I
Right.
feel like it'll be the kiss of death if your product, unless it is aimed at someone who gives absolutely no craps about their health, is high in all three. So
Right.
if you're selling triple dipple chocolate covered, chocolate, then I don't think the average consumer is going to care that they rate high on three things.
Right.
But if you're trying to sell something to anyone that's health conscious,
Yeah.
and so if you have a frozen egg bites, for breakfast,
Yeah.
and they all hit high on all three, no one who's health conscious is going to buy that because they're like, this doesn't seem right. I'm buying eggs, an egg frozen breakfast. I expect this to be good as
Right.
as
Yeah.
as, as far as health wise go. So I think it's going to drastically change the way food manufacturers have to formulate. But this is just a proposed rule. This hasn't
Yeah.
become a law. So, with the changes in our political climate going over to the new administration, this may get pushed further along or it may get stalled. We don't know.
Yeah. It just depends how we don't know how they're going to react. So it could be funneled through quickly or it could be stalled out for 2 years. Who knows?
Yeah. So, we'll wait and see how this goes.
Yep.